Good morning, everyone. My name is Omo Linema, and I'm a project coordinator at the Can-SOLVE CKD Network, which is a Canada-wide team of patients, families, and health professionals working together to improve kidney care and make the health system more responsive to people's real needs. Welcome to today's webinar, which is titled Black Voices in Kidney Health: How to Get Involved and Impact Care. This webinar is part of a national collaboration between the Can-SOLVE CKD Network, the Black Health Alliance, and the Kidney Foundation of Canada. We also have support from the Caribbean African Regenerative Medicine Project, the Canadian Donation Transplant Research Program, and the Health Research Council for People of African Descent. So first, I would like to start us off with a land acknowledgement. I'm joining you from Vancouver, BC, which is the shared, unceded, and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. On a national level, we encourage you all to learn about the Indigenous people of the lands in which you live, work, or visit. In the spirit of truth and reconciliation, Canada respects the self-determination of First Nations, Métis, and Inuit, and their rights to responsibilities in cultures, languages, and the pursuit of wellness. If you know it, I encourage you to share in the chat what territory or lands in which you are currently in. We would also like to acknowledge that there's a long history of harm directed towards Black communities that has been caused by the medical and research profession, and this harm has resulted in inequalities in healthcare that persists to this day. With the acknowledgement of these past injustices towards Black communities, we would like to move forward in a new way where medical research and Black communities can work together in respectful partnership and cultural inclusivity, with patients' autonomy over their health journey. Next slide. We are offering this webinar in both French and English using simultaneous interpretation. During the sessions, the speakers will be presenting in English, and if you would like to hear the presentation in French, please click on the interpretation icon in the Zoom toolbar and choose French as your language preference. When the interpretation is turned on, the sound will be louder in French and softer in English. If you don't want to hear the English speaker, you could also choose to click mute original audio. Today's webinar will be recorded, and you'll have the opportunity to submit your questions in English or French by typing them into the Q&A pane found in the Zoom toolbar at the bottom of the meeting. We will address them during the Q&A session following the presentation. Now I'd like to talk about our sponsors. Can-SOLVE CKD gratefully acknowledges the support of our sponsor Amgen, which has helped make this important work possible. The Kidney Foundation of Canada would also like to thank its 2025 webinar series sponsors, Accenture, Otsuka, and Sobi for making this event possible. So now in terms of the format and what you can expect to learn and get from this webinar, is that the webinar will take the form of a fireside chat with an incredible panel of people shaping kidney and broader health research in Canada. Together, we'll explore why Black representation matters in research, the rights and choices we have over our health data and how it's used, as well as firsthand experiences of participating in research and partnering with researchers to directly shape what research is done. So before we get into everything, we first wanted to acknowledge the fact that Black Canadians are at a higher risk of developing kidney disease than the general population. And Black individuals, we face systemic barriers, including limited access and mismatch in cultural care, and that leads to poor outcomes. And what we need is more community-led and cultural appropriate programs and research to improve trust and improve health outcomes long-term. Next slide. In terms of research, we just want to, introduce the fact that research can be many different things. So essentially what research is, it is a way of asking questions and collecting information in order to find a better way to either prevent, diagnose, or treat diseases. In health research, this often means gathering data from people's health records. It could mean running a clinical trial where you test a drug. It could mean observing people naturally taking what they're already taking or doing. It could also be about listening to people's experiences and seeing how they're living with the disease. And then there's two main ways that you can be involved in research. We have research participants, and then we have patient partners. So as a research participant, those are individuals who join a specific study or project where they're directly trying to help the researchers answer the question and, figure out how we can better answer a problem or treat or diagnose. And so by participating, you can do something as like answering a survey, you can provide samples, or you can share your, again, like your health experience. Whereas a patient partner, you join into the study before the project even begins, and you help shape what idea is studied, you help shape how the study and the research is conducted, and you also make sure that patient and family perspectives are included in the decision making. So kind of what I alluded to, so patient partners are not just patients with lived experience, but it also includes family members and caregivers who are affected by the condition of interest that the research is investigating. Next slide. So we have a wonderful panel of that are going to talk with us today. I'll ask all of the panelists to briefly introduce themselves. If they can say a fun fact about themselves. Well, first introduce yourself, like with your role, your name, the province you reside in, a fun fact, and then how you got into research. Sure. So Dr. Ayo, you can go first.
So hi, everyone. My name is Dr. Odutayo. I'm a kidney doctor and clinical trialist based at the University of Toronto. I got into research actually because of a mentor. So I got into research after my first year of undergrad in 2007, and I've been involved since. And a fun fact of myself, I grew up spent at least 5 years in 4 different countries. So I've been fortunate to kind of live in different parts of the world, and that's kind of shaped my worldview as well.
Great. Jessica, if you could go next.
Hi, everyone. My name is Jessica Ntofon, and I'm joining you from Calgary, Alberta. I'm a kidney transplant recipient. I've had 3 I've had 3 transplants, 2 liver and 1 kidney transplant. I'm a patient partner in the Patient Community Advisory Network, PCAN, with the Crescent. A fun fact about me is I love traveling and I love boxing. Exploring new places helps me feel free and connected. And while boxing also gives me the strength and focus. Both have been very powerful ways for me to process my journey through my illness and healing. And I first got into research when I was invited to participate in a study on sexual health and chronic disease. That experience really opened my eyes to be part of shaping the questions that researchers ask.
Great, thank you. Jemal?
Hi, so yeah, my name is Jemal Demeke. Currently, I am a researcher at a place called Wellesley Institute, where we do a lot of research on health equity issues to develop policy recommendations. My focus is on the collection and use of sociodemographic data. So any questions about gender, race, sexual orientation, and the like, I focus heavily on race-based data and how that can be used to improve the lives of Black communities, and specifically through involving Black community members and how organizations decide to manage their information. I got into research kind of in 2 different ways that ended up coming together. Back in my undergrad, I was working for a human rights center, and then eventually they needed someone to speak at a conference, and that's how I eventually met my mentor, who does research on Black communities at Yale, but he had a lab here in Toronto. But then also separately, I got experience more in like cell culture, that kind of biomedical research at the same time. Anyway, 2 very different types of research, and I decided to figure out a way to blend both, the heavy, intense health focus in the data while also focusing very much on Black communities. Fun fact, I guess, just quickly, I would just say I'm a big live music person. I last year I saw about 25 to 30 different artists across multiple concerts and music festivals. So I just love art. And I think it's important just to sometimes slow down and just find things to bring you joy. So, yeah.
Great, thank you. And Suzanne?
Hello, everyone. My name is Suzanne. I live in Ontario, about an hour and a half north of Toronto. I am here in my capacity as a parent. So I have one child who has a rare and complex medical diagnosis. And one manifestation of this diagnosis is kidney disease. So my experience is as a caregiver, and it's been quite a journey. I always say but I know more about the Canadian healthcare system than I ever wanted to, but I'm very glad that we have it. Professionally, I'm French and Spanish legal and official document translator. And a fun fact about me is that when I was an undergraduate student, I spent a semester abroad in my third year in Chile. Thank you.
Great, thank you. So now we will move on into the direct questions for all the panelists. So we'll just take the slides down so we can just see everybody's screen faces a bit better. So first question will be for Dr. Ayo. Can you tell us from your perspective as a Black nephrologist why representation matters? Kind of at all levels, Black representation for researchers, patient partners, research participant. Why does that matter in kidney research specifically? What difference does it make for patients? As well as talking a little about the difference, between, let's say, observational trials and clinical trials. It's a very long question.
No problem. Happy to open the conversation, and I think obviously the discussion will evolve even beyond what I do say. As you mentioned, there are different types of research, and I think understanding this requires us to kind of contextualize in each type of work. So, I'm going to talk about two broad types of research. So we've got what we call observational studies, which are studies where we follow people and try to understand how risk factors or blood tests or genetics can help us understand people's disease. And then there's clinical trials where we're testing the effect of, a new medicine or a new strategy of how to treat people on a health outcome. And I think part of really understanding the role of race in research, also comes down to really teasing out whether our similarities and differences as humans affect how we should understand health and well-being and how we ultimately treat people. So this is not just a question about biology, it's also a question about psychology, sociology. So it's very cross-cutting, this question across a range of topics. Representation matters in research. And if we want evidence that will guide practice and be accepted by the people we look after in healthcare, we need representation. And I just want to provide a bit more granularity by just talking about each type of research area first. So the first study I want to talk about is the observational studies. These are studies related to understanding risk factors and tests that help us understand disease. And I think a really good example is around how we measure kidney function. So I think a lot of people in this community know that we measure kidney function based on something called your GFR, which is your glomerular filtration rate. It's a number that summarizes how well your kidney cleans the blood, and we can, roughly consider that number from a scale of 0 to 100% function. Before this, many years ago, almost 20 years ago, we were trying to figure out how to calculate your GFR using a whole bunch of different formulas. And someone finally tried to make a very good concerted effort to create one formula to use. And that formula had a few components to it. It had your creatinine, which is a blood test. It had your age, it had your sex, and it had your race. And on that basis, the race factor in that formula actually resulted, for the same creatinine, same age, resulted in a higher GFR for Black patients as compared to non-Black patients. And that was what the race factor was, whether you were Black or not Black. And as we all know, race is a social construct. And what's even more challenging about it is with that formula, sometimes it's not necessarily always your self-identified race. In the chaos of a clinic appointment, sometimes people have to assume what your race is and then use that to understand what your kidney function is. And the challenge is that kidney function number then ultimately determines what medications you get, when you get listed for transplant, when you get referred to a nephrologist. So it has a cascading effect. And you then have to ask yourself, in 2022 was a time when people start to look back at this question, think about it around the time of COVID, George Floyd, and started asking questions about the importance of race and how it affects everything we do. And people looked back at this equation and said, is this necessary? And really, there was a number of editorials written asking about why can't we do this without race? And obviously, some people came to defend the equation, saying it captures something that, it's not about race, it's about the variables that race encompasses, whether that's social demographic differences. But ultimately, with enough momentum, we were able to create an equally useful equation that does not have race in it. And why is that important? That's important because then it takes race out of the immediate decision making that your clinician has to do. And why did that change come about? That change came about because of representation. And I think what was missing in that first effort to create the equation is that the team that created the equation did not have sufficient representation, where in representation in terms of Black individuals in the research team. And also at that time, patient involvement in research was not very common. So we did not have one, patients involved in research, but two, representation among those patients, if there were any, in helping to really say, this is a little bit silly. You know how you need that friend that sort of tells you this doesn't make sense? That wasn't there. That did not exist. And that's how sometimes science charges forward without thinking about how this actually plays out. So representation matters. And I think that example tells you about one type of study where, the researchers that are involved is important to have representation because they help shape the question. It's important to have representation among patient partners because they are the ones who this research is going to affect. And they can give you that immediate feedback that I don't want to be in a rush clinic and someone decides what my race is. And then obviously, and what's interesting there is that study had representation of participants. So there were Black people involved in that. There were Black patients in that study who contributed their blood test results to help derive this equation. But you can see that that in itself is not sufficient. You need to have people in the decision-making parts of that study in order to ensure it's shaped in the right direction. I want to pivot briefly now to clinical trials because I think it's a little bit more nuanced. A clinical trial, there are two types. One is if we're studying one medicine versus another. And in clinical trials, so for instance, you can think about it like, let's say in COVID, we're studying whether a medicine called dexamethasone, which is a steroid, helps prevent your COVID from getting worse versus a sugar pill. It's important that we, again, have sufficient representation in studies because, I think, but there's a nuance there. The nuance is whether we think the biology of a treatment or a disease will vary between us based on our race. And if race is a social construct and an imperfect construct, it's challenging to believe that race in itself is truly going to capture differences in biology. That's why a lot of people talk about ethnicity and ancestry when we're thinking about, where possibly historical biological differences can affect treatment effects. And so, I can't say that necessarily we had perfect representation in the studies of COVID medications, but would I say someone should not take a COVID medicine because there was not sufficient representation? No, because in general, as humans, we're more similar than we are different, right? So it's really important that we also acknowledge that piece, that there are certain types of study designs where the treatments are likely probably more consistent in their benefit across populations. And we need to do better about getting more representation because there will be chances that there are important differences. And if we don't have sufficient representation, we'll never find them. We'll never know of them. Having said that, the caveat is in clinical trials, we have a lot of history of when we have the evidence that something works, there's low uptake. And the reason there's low uptake is because there's lack of representation. People don't see themselves represented. The researchers don't look like the people, they don't see themselves in the researchers. And on top of that, there's a background history of clinical trials being used, in a very malicious way against Black populations, and bringing Black individuals into studies without thinking into unethical studies and experiments, which actually resulted in more harm than benefit and were scientifically dubious. So there's a really engaging patients in research, whether as patient partners, participants in the research, and engaging a diverse research body is really important to overcome that sort of historical damage that's been done so that we can actually translate this evidence. And I'll be very brief because I think I've only got one more minute here. But the final piece I'll say is the third type of study is a clinical trial about strategy. How do we do best with what we have? So we've decided a medicine works, or we've decided that it's good to treat someone's blood pressure. Well, how do we do that? Well, we need representation and research from among the researchers, because when you have representation, people can think about how to translate what already exists into practice in the right way. And one of my favorite studies is a study of blood pressure management in barbershops, and actually showed that when we actually roll out an intervention, which we all agree works across biology, lowering blood pressure prevents kidney disease, but then we roll it out in a way that's really in tune with the communities that we serve, we can actually have very important effects. So representation is critical. It occurs at multiple levels. It can be nuanced sometimes, and it's important that we, even in our fight to ensure representation, we don't empower race as more than a social construct. It really is just a social construct that's often used to oppress and break people apart. But it's really important that when we're trying to think about a translation of evidence to practice, we're thinking about, how medicine or treatment strategies will affect populations, that we have representation across the spectrum of the research team, from the researchers, patient partners, and the participants themselves.
Great. Thank you so much for sharing that. That's been really interesting to hear all the differences and the nuances. I will now move on to a question for Jessica. Can you please share your experience both as a research participant versus your experience as a patient partner? Or I shouldn't say versus, and your experience as a patient partner.
Thank you so much. My research journey started during one of the most vulnerable times in my life. I was really sick and trying to navigate the emotional and physical toll of, the chronic disease, and also simultaneously as well, I was waiting for a liver transplant. So at this point in time, I was invited to participate in a study that focused on sexual health. And at first, I felt really nervous, and I was very hesitant. Like, I didn't know what sort of information I would be giving them. Talking about intimacy while managing a serious illness felt very overwhelming. But then I also realized that, being part of this study would definitely help someone else that might be going through the same experience of, kind of like feeling isolated and misunderstood. Because there were also questions I was asking myself while I was going through, my health journey at that time. And there were also things that I did really want to understand as well. So that study sort of gave me a voice, and more importantly, it reminded me that my story mattered, and it made me feel heard, and it also made me feel seen. And that gave me the confidence, to kind of participate in that study. And then later on, I joined the Patient Community Advisory Network with PCAN, with the Crescent. This was also a really turning point in my life, because it opened me up to opportunities like this, to share my story, to advocate, and also collaborate. And it also made me feel like I wasn't alone, like I had people who, understood what I was going through, who understood the disease, and we could always, help shape the future of kidney research. I also realized that, being a patient partner isn't about having a medical background. I always thought I had to have a scientific background or a medical background, but it's about bringing my lived experience and helping researchers understand what it's really like to live with kidney disease. It made me feel very empowered to know that my lived experience could guide science in a more human direction. I'm also learning to use my voice to represent others like me who might not have the chance to speak up. I'm also, just sharing my experience and helping others like me who don't understand how to manage the disease and, the social aspect of the disease, the psychological aspect of the disease, and also the mental aspect of the disease as well. Being a patient partner has also helped me grow personally. It's given me a purpose. It's helped me heal and also allowed me to advocate for others, especially young Black people who might not see themselves, reflected in healthcare spaces. I want them to know that their voices belong here, and I also want them to know that they're being seen and they're being heard.
Great, thank you. Just a follow-up question. As you mentioned, when you first started, you were, as you're going through a hard time with the illness, trying to adjust, trying to participate, and wanting your voice to also help people in the future. Was there any supports that you got that kind of help you feel more empowered or equipped to either be a participant or be a patient partner, like just in your experience, anything like that?
Yes. There were a lot of peer forums at that time on the internet. And when I was approached for this study, I kind of did a little bit of research, and I found that there were a lot of forums, and at that time as well, I was very young. So all over around the world, I had come to realize that a lot of people were asking the same questions I was asking. It was kind of like a community where, people were talking about like, oh, I'm young and I'm going through this and my body's going through this. There's a new identity, is there anything, or is there anyone doing something about that? So that kind of made me sit back and think, I'm like, oh, you know what? There's a lot of people, a lot of young people and young Black people as well going through the same disease that I'm going through. So this is a chance for me to kind of use my voice and to participate in any kind of aspect of study or research and help with the science part of it. So there's a huge peer forum on the internet that kind of helped me to get into research.
Great, thank you so much.
Yeah.
So now my next question will be for Jemal. So Jemal, many patients wonder about what happens to their health data in research. And I think especially with our community, I think Dr. Ayo talked a little bit about at the beginning of how, historically there has been some harm in how things were done to Black communities and how our data was used. So I think when people think about research now, they're like, okay, I'm kind of interested, kind of like Jessica, they want to help out, they want to, help people answer questions, but now they're like, okay, but what if I do? And then my health data what's going to happen to that? Is this going to be used against me? So we're hoping you can talk a little bit about that.
Yeah, just thoughts around what happens with our health data, I guess.
Yeah.
Yeah.
And
So
data sovereignty, introduce what data sovereignty is and what happens with our data. Yeah.
So yeah, I mean, there's a major issue with how a lot of legislation works with our health data. I mean, quite unfortunately, what happens is once it enters into the healthcare system, once a hospital or healthcare site manipulates that data in any way, de-identify it, right? That is now technically legally within the ownership of that health information custodian. Right. And so that is a problem, right? And that sounds scary. Why would I want to give more data than if, I basically feel like I'm giving it up? So there's the other side that we need to think about this too, where data can also be incredibly helpful to reach some of our goals and address the problems that we're trying to talk about today, right? Even as Jessica was noting, right, there's so many people out there who are facing issues that aren't currently we don't have any evidence, I guess, technically of it happening the way that healthcare systems understand evidence. And that is a challenge. And so we really need to think about then what are the ways that we can feel more comfortable providing information to the healthcare system while also knowing that it will come back and benefit us, right? And not go off into this, ether. And so that's where this idea of community data governance that I work a lot around comes in, which is the thought of, hey, if you're going to be asking people, for their information, let's involve them in the decision-making process. And that's something that I work with a lot of hospitals, community health centers, government agencies around doing. And the other side of it, though, that I would say just for everyone, so you don't feel intimidated coming into this, you don't need to know anything about the law. You don't need to know anything detailed about data. Just as Jessica was saying, you don't need to be an expert in, clinical science or anything. One thing that I often say to people, or I like to ask people, right, like, how much do you know about data? If I were to ask you that question, then you would probably, a lot of people will be like, I don't know. But when you actually think about it every single day, what are you doing on your phone, right? What are you doing on your computer? How do you get information, right? Resources. ChatGPT is now in, you may have heard of it, you may have heard good things, bad things. A lot. And so that's why I actually like to focus on a different question that I ask a lot of organizations is like, how much do you think people know about data? Because people know a lot more than they think that they do. And then even at the third question that I sometimes ground us into is, how much do you need to know really to come into this? And the answer is nothing. Like, you don't really need to understand the details to know what's right and what's wrong for you, right? You have the issues, and we need to figure out a way to have that come into the system, and that we design, a data process that again comes back to benefit yourself. I'm also, just if I were to quickly mention, right, I'm doing a master's in artificial intelligence and health systems right now. And sounds fancy, sounds grand. But one thing that I have learned, though, being in here and developing my own algorithms, is actually these things are not, please do not think that they're smart, right? They're a tool, they're technology, just like everything else. Intelligence is the worst word to use for them. And they don't know more than you can know possibly, right? They just collect information and put it together based on a best guess. And so if we are purporting that is an expert in something, right? Even though all it's doing is taking what other people have said and just saying it differently, you yourself with your own original experiences and ideas is definitely going to matter more. So with that empowerment, I hope that changes the way that you see about data and how you think you can be involved in the process.
Great, thank you. And a follow-up question would be, if someone is going into a study, whether as a patient partner or as a participant, and they have more questions, how can they do you have kind of let's say a template question that they could ask the researcher or ask the team to get people getting that conversation going? Because maybe that particular researcher hadn't thought about that, and that particular study is either geared towards Black community or it's general, but they have a high population because of where the study is taking place. Is there kind of a question you would recommend patients to start off with to make the researchers think and not just, go through with their standard practice?
Mm-hmm. I mean, one thing for us all to remember is in this public healthcare system is that everyone is supposedly there to serve you, right? So and support you in this process. That's what it should be. Obviously, we have lots of different experiences that can help us, think of that differently. But when it comes to asking questions, right? I don't want to oversimplify this and just say, if you ask the right question, they'll listen to you. We know that's not necessarily how it always works. But the more that also you present that you think and that you're on top of it, right? The more stress that people feel, and that they feel that, okay, I need to actually come back to you. I'm accountable to this person. So at the very basic level is, asking, why do you think that this would be right for me? And, I very much explicitly talking about, Black communities, Black patients, Black populations. As, Dr. Ayo was saying, though, of course, lots of things don't have specific data on Black people. That doesn't necessarily mean that it's useless, but it's also important for you to use the resources that you have, which is, the healthcare team that you're interacting with, to ask and say, hey, I want this back, for myself, put it down in my chart that I asked about this. Like, I really want this information. And most often not, one thing I just also will put out there is, they're usually patient and family committees, not to say that that's the be all end all of it, but at healthcare centers. So just even sending an email or finding a number, asking to be in contact with them, you know, with your provider, could also be a helpful connect to make sure that you're also supported through it by people who understand, you know, what it's like to be a patient coming into the system. But nothing will be perfect, but again, it's about just starting and setting the tone right, that, hey, I'm here and you can't just tell me something I'm going to follow. I want to know more.
Yeah, no, that's great. I'll definitely take this advice as well of like, yes, we need to be assertive and say, we're here. We have questions. What are you doing with this data? How are you going to use it? I think that's, like you said, there's no perfect question, but just showing that you want to know that information and you're holding them to it and there should be record of it. I agree. That's so important. Thank you. Now our next question is for Susan. So Susan, as a parent partner, you bring in a different perspective of having to, make decisions for your child and engage in research in a way that where you're advocating for them. Can you share a bit about your experience as both a participant or, with her as well as a patient partner?
Sure. So, like Jessica, I started off as a research participant for the first time in 2022. And by that time, I'd already been making these decisions that almost so deftly referred to for almost a decade. So I never got involved until my daughter was almost 10 years old. And the reason for that was very simple. I had no idea I could get involved. I never saw a research study poster. I was never approached about being a participant, whether it be myself or as a caregiver or my daughter as the patient. And I was never approached to be a parent partner either. So I always say I stumbled upon becoming a research participant and a parent partner. And it was through seeing a poster for an engagement council. They're looking for parent partners at the end of 2022. So I became a parent partner for the first time in March of 2023. And that was with a different organization. And I became involved with Can-SOLVE CKD and CNTN at the beginning of 2024. So I never had the opportunity to really share my experiences. And when I did get that opportunity, I was very delighted because I had a lot to say. I also think at the time when I got involved, I was at the stage where I was ready to do so and contribute in a meaningful way and not just rail at the system, because that's something that a lot of caregivers and patients do. And it's not necessarily wrong because our system is not perfect. But for me, I felt if I'm going to partner and engage in research, I have to be at a point where I can constructively contribute to the research. If it's just going to be a whole bunch of animosity and frustrations, and like I said, railing against the system, it's not going to be a beneficial relationship for the researchers or myself. So for me, being a research participant really opened my eyes. I like the fact that I was able to share what my experiences were and, realize that, this can affect other people in the future. And that was really important to me because I think it redeems experiences, whether they're good or bad. Once I became a parent partner, that was even more so exciting in the sense that, actually speaking with academics and clinicians in a way that was supposed to be as equals. And that's not something that really happens to you when you're a patient or a caregiver, when you're in a clinical setting. For me, I always felt I got my marching orders from the doctors and I was just doing what I was told. So, and that's not necessarily wrong because I do not have a health, medical, or scientific background. So the doctors are, of course, the experts. But it really felt as if there was a locus, an external locus of control over what I was doing, and I really didn't have any input. Now, as time has passed, my daughter has stabilized. I feel that I've built relationships with all these different specialists. I feel more so like a partner in the clinical setting too, but that took a long time to get there. So I've been involved in a number of different issues because of my daughter's condition, its complexity. There's about 17 different specialties involved at different times. So there's so many different places where I could kind of hang my hat in terms of sharing my lived experience. But I never had the chance to get involved with anything to do with kidney disease, pediatric or otherwise, until 2024. Nothing ever came across my radar to get involved. So I was very happy when I stumbled upon Can-SOLVE CKD, because it gave me a chance to say, this is my experience as a parent of a child who has kidney issues.
Great, thank you. So just building off of, as you mentioned, you're a patient partner in Can-SOLVE CKD. Can you tell us a little bit about, as well as CNTN, which is our clinical nephrology trials network. Can you tell us a little bit more about, how you stumbled upon or how you heard of Can-SOLVE CKD, as well as, how you felt supported, what impact you feel like you've made? Just give people a little bit more insights to, if they're interested to be a patient partner in this network, what has been your kind of lived firsthand experience of it?
Sure. So I actually got connected because I was doing some modules that are hosted on the Can-SOLVE CKD website, but it wasn't for Can-SOLVE. It was for something completely different. I think other organizations had to do them, so I did, and that's how I found out about Can-SOLVE. And then I got involved with the PGCs, the Patient Governance Council, and then also CNTN came up in one of those meetings. So it kind of just snowballed from there, just talking to different people who are already involved. And for me, I'm learning a lot about the whole kidney disease world. I feel that, when you have so many different things on the go, you become, a jack of all trades, but you're not an expert in anything. And when I say an expert, of course, not as from a medical perspective, but as a caregiver, kind of having more of an in-depth understanding of what my daughter is dealing with. So for me, being part of this has been very, very helpful, expanding my knowledge, moving from just a caregiver perspective to more, I guess, substantive knowledge of what's really going on. And I feel more confident asking more questions about, what the long-term prognosis is, things like that. And having materials that are in lay terminology is helpful too. You don't always get pointed to that as a caregiver, as a patient. So just knowing there's an organization out there that's supporting people in my situation is, was just an incredible discovery. And out of all the different diagnoses that my daughter has under the umbrella rare condition, the kidney issue has taken up a lot of the time with medications and clinical visits and different kind of imaging interventions. So I'm glad to find an organization that's focused on that.
Great. Thank you so much, Susan. And thank you to, as well, again, to Jessica, Jemal, Ayo. Before we get into the Q&A, I would like to, well, sorry, let me start over. So all of your perspectives have been very valuable for letting people understand why representation is important, and the experiences you've had, whether as a patient partner or as a parent partner, in getting involved in research. And so I would like to highlight for our attendees ways that if you would like to get involved as a participant or as a patient partner, what you can do. So first, I would like to highlight a way to get involved as a participant. So if we can get the slides back up, I can talk a little bit more about that. Okay, so as the slides are coming up, yeah, I'll just share that, I think, well, I think that it's very important, it's very valuable to participate in research. And I think it's important to note that there's so much variability in the time commitment that you can provide and choose in the type of research you're doing. If you decide to participate in a survey, that could be 5 to 10 minutes. If you decide to participate in a focus group, that could be one time, 2 hours. If you decide to participate maybe in an observational trial, sometimes that can be a little bit longer. It can be several months. It could be a year, but maybe in that year, you're only doing maybe 2 visits when you're already going into clinic, and then they collect your data. Or a lot of, post-pandemic, there's a lot of ways to participate in studies virtually as well. So I really just say this to just say, if you're like, oh, I'm interested in all of this, but I'm not quite sure of the time commitment, just know that there's so many different ways that you can participate that can fit your schedule. As well as, like I said, another thing with the observational side, there's clinical trials, which again, there's ways where they can mail the device or the drug or something to you. Or if you come in for a visit, it's once a month or every 3 months. So there's different ways, and different studies will let you know what their time commitment is. And you can choose if that works for you and your current schedule, as well as like health state and how that pans out. One great platform that you can use to find these different research studies that I'm talking about and participate in is KidneyLink. So KidneyLink is a national platform, so it shows you research that's happening, kidney research that is happening across Canada. KidneyLink, it was put together as a partnership between Can-SOLVE CKD and the Kidney Foundation of Canada. And when you get on the website, so we do have the QR code as well as the, what is it called? The link to the website here. And if you were to go on it, you'll be able to see that you can, you're able to, there's a filter, and you can filter the list of studies so that you can filter for, let's say, the province you're in, what type of opportunity is, whether it's like virtual or it's something you'd have to go in person. You can also filter for type of participation, like I mentioned, of survey, focus group, etc. You can also narrow down the topic or the treatment or the diagnosis. So there's a lot of different filters and ways to see what kind of study would best work for you by going on this website. And if you go to the next slide, then I'll talk about more now on an opportunity to be a patient partner. So as we've mentioned, I'm part of Can-SOLVE CKD Network, which Susan is also part of, and there's our clinical trials network that Dr. Ayo is also part of. Can-SOLVE CKD is a national patient-oriented research network. So when we say patient-oriented, that means that patients are really at the center of everything we do and is also included in every level of our organization. So that means even our leadership team, we have patients involved there. We have patients acting as co-chairs in our committees and in our councils. So we really believe in patient partner empowerment in our organization, and making sure that it's not just a, this kind of token, like, oh, we've signed that, yes, patients were involved. It's like, no, we actually want to hear your voice, hear your opinion, and see how we can work together to shape a research question and do it in a way that is getting, the patient or family member or caregiver perspective, and not just what the doctors or researchers think you want. So Can-SOLVE was launched in 2016, so it's quite an established network, and it offers you a range of opportunities to get involved, again, with what fits your schedule or your comfort level. We also provide a lot of different training and supports along the way so that you feel prepared, supported, and empowered. So now you can see on this slide that we have several councils. So we have a patient governance council that Susan is part of. She talked a little bit about. We have an Indigenous Peoples and Engagement and Research Council. We also have patient partners that sit on specific research projects. And then we're starting up a Black Research Council that we want to launch to kind of launch and kickstart projects that are specific to what Black individuals living with kidney disease will need. So there's these different councils. You're able to join many or one or whatever you're able to do. Again, we're all about flexibility, and we also encourage, if you're going through a period where dealing with your health or, you know, your family members or your caregiving responsibility, like just life happens, you can take a break, you can pause, you can come back. So we offer, like I said, a lot of supports, a lot of flexibility. And on the screen, again, there's a QR code to our resource page that has resources on different modules that we have available on just different skills and knowledge you might want to know about, you know, the landscape of kidney research in Canada, different skills of like what we call peer review. So peer review is a way that it helps you to, so when a researcher has a project, before they apply to get funding from it from the government or from a different company, they want a patient to review that proposal to say, okay, here's some gaps that I've seen. Here's some stuff that you've not necessarily accounted for. And so we have a peer review module that helps you and empowers you on how you can do that, how to you know, read those proposals. And, you know, we also, I think Susan alluded to, there's also resources that we can help provide that give you, what is it called? Like materials to help. We also make materials to make things more plain language in terms of like, so that's not such scientific jargon that is so hard to understand or read through. You also get, you know, you get a way to understand what's going on in that study in a way that is, you know, that any person without any background is able to read it. Because like Jessica and Susan said, you don't need any training, you don't need a medical background in order to be a patient partner and be involved. Great. So I think now that I have, oh, and then quick thing, after the webinar, we will also have a resource handout that will have some of these resources that I've talked about, as well as just general health resources as well on management and diet tips and other stuff like that. And if you are interested in joining our network as a patient partner, you can we'll have my contact in the last slide, and you can reach out to us as well, or go to our website and contact that way as well. So I think now we're good to jump into the Q&A. So if you haven't already done so, please submit your questions for the presenters or even myself by typing them into the Q&A pane found in the Zoom toolbar at the bottom of the screen. Please avoid using the chat box to submit your questions because it helps us monitor them more effectively if it goes into the Q&A. So I know that while we were doing, we already had some questions. Oh, and I see some more, which is great. So the first question I see from the chat or from the Q&A, is for Susan. So they asked, as a parent, how's this journey been like? What are some of the challenges or sources of strength you've experienced? And what would you change to make care feel more equitable and supportive for families? It's kind of a multi-layered question, but the first part is just, yeah, your journey, your challenges, the strengths, and what do you think needs to be changed?
Well, it's a great question. Thank you for that. I found the journey very challenging, very, very difficult. I think for a number of reasons. First of all, it was very unexpected. Not realizing that my daughter had any issues before she was born. And I'm also a veteran NICU parent, and that is another experience that, you know, it can be really life-changing to have your child in there. The other thing for me is that I had zero experience navigating the healthcare system in a meaningful way. I didn't have anybody in my circle that had ever been sick, you know, in terms of having a chronic condition. So I had no reason to really know too much about the healthcare system. And I went from very little knowledge to having to learn it like right away. It was also the amount of care and the amount of appointments and the travel, everything is very overwhelming. I expected to kind of be navigated through the system by the system, and that did not happen. So people were very kind. And I always say that the actual care my daughter has received is very good, but the structure, the framework to support caregivers and patients when they walk out of the doctor's office, it needs some work. So I found that so many resources, information that could have helped were not coming to me just through, a systematic way of providing information to patients and caregivers, I always had to stumble upon them or look for themselves, myself. And what that does is it adds an extra burden on you as a caregiver. And a lot of times people don't wind up pursuing certain programs, resources like that, them because it's just another thing they have to deal with, another form. And they think, well, by the time I do that, that's taking away from something else. So I just won't bother. But that adds to the caregiver burden or caregiver stress. So for me, I would like to see more of a push towards sending information out to families. So the minute you're admitted, whether it's an adult or a child, you get a list of, say, certain programs you should be applying to and support groups for this particular condition. So for me, that's where I feel things were made much more difficult because that didn't happen. The question also asks about sources of strength. And I would say for me, the parent groups for parents of children who have special needs, any kind of health condition, are a gold mine. Can't do it without them. That's the first thing I would tell anybody. And I always regret not joining earlier in the journey because parents really know everything. They really do because they have to, and they have to go and search out for this information. So if anybody has a child, has some sort of condition, whether it's a big, massive group that's more general nature or one that's specific to their condition, I would highly, highly recommend joining. Primarily they're on Facebook. I call them the special needs parents water cooler. That's our water cooler where we learn about everything. So I hope that answers the question.
Great. Thank you, Susan. Our next question in the chat is kind of giving us a little bit of this similar, not similar, but I think with what Susan talked about, some of the challenges of not having those resources and stuff while they're available kind of connects to this next question. So this question is for both either Dr. Ayo or Jemal can answer. We have an attendee that's wondering, can you tell me a few ways to navigate or mitigate barriers to data collection within areas that have low Black populations? Like, what would you recommend? And this also makes me think, of what Dr. Ayo mentioned at the beginning of going to barbershops for that blood pressure medication. Is there different strategies or ways that we know we can engage our community that you would advocate for researchers to do more, or for, that kind of thing? Of what, any other, just any ideas of how to navigate that?
Sure, I can maybe go first. Yeah, I think it's actually just building off of what Dr. Ayo said. And I will also say I live in Toronto now, but I lived in a town called Guelph, which is like an hour outside of Toronto. Pretty small Black population. But one thing I can say in reflection of that experience personally, but also doing research on Black populations across the entire province of Ontario, is that in the smaller places, the Black populations usually are networked pretty well. That's the thing. Maybe there's a low percentage when you contextualize the population of the whole city. But then when you actually look at if you're to see who all knows each other, interacts, what areas, where do people go, you'll then see more common things. So, barbershops being one of them, faith-based, institutions, or even just going down to, the grocery stores in the areas where a lot of people live. Not to say that that's where everyone will be, but it's the socialization out there as people talk to each other. That's going to be important as well. And I get this from I did some research on vaccine distribution strategies for COVID, but for the United States actually, but focused on Latinx populations and Black populations, and just to see what has been working for people to try and get information out there, but also people to get vaccinated. And it was exactly this that we found in the literature, based on the reports, right? It's those efforts of going in. You can, go to schools, go to all those things, but it's also thinking about how you want to target people, because of course in the healthcare system, limited resources, right? And you're trying to think, okay, let's do this right, because if you just go to a school, which is still important. But if I have to make a choice, I'm going to ask the questions. Is there a reason why this particular school will drive, information dissemination among Black communities? If there's no real logic or rationale for that place specifically, then I would hesitate to do that. But when there are so many other options, right? That, and I think building off of the faith-based institutions, also think about other community organizations that people already know about or talk to. And then just hearing, I think, and sometimes it's just about hearing, how do people talk to each other? Like, is there a Facebook group that you don't know about that everyone's a part of? Because you're, an organization and you may not know this, but then actually everyone is in there. So, once you listen and understand too, like how people are networked, I think that's how you then figure out, right, how to get the information out. But it always starts with engagement, right? And figuring the first piece out.
Great, thank you. Dr. Ayo, do you have anything to add? And talking specifically as like, as a nephrologist when you're seeing patients, because even thinking back to what Susan said about like, she'd have liked when she's in the hospital, she's seeing the clinicians to get those resources then. I think, do you think our current setup, what are, the challenges with the current setup of getting information to people in clinic?
Yeah, no, I think it's a great question. I think there needs to be sort of this philosophical change in how we see research on the clinical side, because, I think not every clinician thinks about research as a parallel pathway of providing good comprehensive care. And that means that the opportunity to get involved in research will then, if it's not actively offered to everyone, will cut across social demographic lines based on subconscious biases that we have or opportunities. So if people are well connected outside of the clinic, then they'll ask about research. If they're not well connected, they won't hear about it. So it ultimately perpetuates the disparities that we already have. So on the clinical side, we have to do a better job from training, medical students to residency to making research part of the process. So actually, in my first visit with a patient, I tell them, we are a research institution. We have studies of new medicines that are coming forward. Would you be interested in hearing about them when the right time comes? The other reason is actually critically important is because for years in nephrology, we only had one medicine that really altered the long-term trajectory of kidney disease. It was called RAS inhibitors. But now we have multiple other medicines that work, and they work in a time-sensitive fashion, which means that if I start you on this medicine, your benefit happens at 6 months. So if I don't tell you about this medicine early enough, I don't tell you about studies that might open your access to this medicine, and you don't hear about it until the medicine actually comes to the market in 4 years, or OHIP decides to cover it, you've lost 4 years of opportunity of reducing your long-term trajectory. And improving your health now compounds. It's like, what they say, the stock market. If you improve your health now, that benefit will last you longer. So it's really important that, we're actually now in a stage in nephrology where a failure to think about research as a parallel pathway of health and well-being further perpetuates disparities in long-term outcomes for kidney disease. So I think we have a lot of work to do for ourselves. I think the broader question was around how to engage communities where there's a low population of Black people. I think some of that messaging should also be part of the phrasing when you go into the smaller communities, and try to make sure that, research is seen as a parallel path of, so if it's in a church, if it's in a after-school program, that research is part of wellness, right? It's another pathway to get to wellness, another pathway to break down barriers to wellness. And I think now that's obviously an aspirational goal. If we ultimately get there, I think it makes this a little bit easier, but that's what I would aspire to. Let's just say that.
Great, thank you. Just looking at the Q&A, I think we've answered involved. I think, yeah, so there's another question for Susan, but I think you already kind of answered this of like, well, no, you noted that there are not necessarily opportunities to be involved. Are there methods or approaches such as the poster you mentioned that would be effective to encourage patient involvement? I guess the question is more of like, what kind of method or approach do you think would work for you? Would a poster be sufficient, or do you think there's other methods we should invest in?
Sure, another great question. I'm sure Jessica would have some insight into this as well, as as a participant, as a
Mhm.
partner. So for me, the poster and the Facebook group is how I got involved. I would not have gotten involved otherwise. And as I became more involved, I would hear researchers saying, well, how they were trying to recruit people, whether it was as a participant or as a partner, would be they're putting up posters in the hospital. Well, I've been in and out of so many different hospitals for more than a decade now, and I don't remember seeing any of those posters. And there's a couple of reasons why. When your child is an outpatient, it tends to be very busy when you go in clinic days, and it can be very rushed. There's a lot of people, and especially if you're traveling in from out of town, because not everybody lives close to a pediatric hospital, you're thinking about getting in, getting the appointment done, and going home. So if there are posters, and now I kind of keep an eye out for them when I go, because now I know that researchers are actually doing this, it's not enough to equitably disseminate this information to all the people who could be involved. Because if the poster goes up a day after they come in for their child's clinic visit, then they miss it. So for me, I think the best way is to start with online. Now, I know there are now issues with a lot of spammers and scammers, as they say, emailing researchers, taking the information from the research study posters and basically contacting them as illegitimate participants or partners because they're looking to some way get compensation for that. So that is the other side of the challenge in terms of distributing this information on social media. So I can see both sides of it, but I do think that because so many parents are on Facebook and in these large groups, that is the way they find out about the information. The other thing too is, even if it's not one of those large generic Facebook groups, you could also try connecting to larger organizations that are connected to specific condition. So for example, there's an organization that focuses on ADHD called CADIC, it's their acronym. And in their bi-weekly newsletters, they will have different research opportunities in there. And this way you're reaching a market that's kind of been vetted, for lack of a better term, because people are signing up who are interested in ADHD. So to me, that's how I always found out about the information. Still, 2 years into being a parent partner, I still have not been approached by any academic or clinician involved in my daughter's care to be part of a research study. So I couldn't say any way to get involved, because that's the only way I have been able to get involved is through these postings on different parent focused groups. So that's what I think is the best. For some reason, it seems the hospitals or different institutions don't want to do email blasts out. I always thought if there's something that I can get involved in, the hospitals just send it out. Well, that did never happen. So, and I guess there's a reason for that, but I don't know what that is. So I would love to see the institutions, reach out towards the patients and caregivers proactively. But I guess there might be some ethical issues to do with that too.
It's some ethical stuff.
Yes.
Exactly.
But,
you hit the nail on the point. Yeah.
So it's I know it's complicated, and now being involved, I see there's more than one side to it. But if there isn't more of an effort made to contact or get in front of more patients and caregivers, you're wind up with a situation, which I see, which is the same people always being involved.
Yeah.
And I know that I've been involved in a number of things, and I also see the same people involved in a number of things. And you get also kind of the same kind of person. So this goes beyond race. It goes to, your mindset. What is your background? That sort of thing. And a lot of times I'll be involved in something like, wow, a lot of people here are just like me. They've kind of had the same life trajectory, that sort of thing. So that's why I think it's important to find a way, like connecting with organizations, for example, where you're going to get a lot of different types of people with different perspectives. Because right now, yes, there's diversity in terms of how people look who are involved in research, but not necessarily diversity in perspective or thought, because a lot of people get involved are very similar. So that's my perspective.
Great, thank you.
And maybe Jessica has a different perspective than I do.
I think I share in your perspective because, like you said, like when you're in and out of the hospitals, like you're not really checking to see if there's like a research opportunity or anything. And for me, like I was very young when I started my health journey. I think I was 17. I had just moved to Canada from Nigeria, so it was kind of like I was just thrown into the wolves, after having my first liver transplant, and then in 2020 having the combined liver kidney transplant. I I I didn't really get any information, so I wasn't really looking for any sort of like research opportunity, to be fair. But if there is sort of like an organization that's like really focused just on that, I think that would be a good medium as well. Like you said, like Facebook is also a very good medium. And one of the ways I even got into the patient partner role is, I think I was Googling like kidney diet or something, and I ran into the Kidney Foundation of Canada. And that's how I, found all this information and like ways I can join research and ways I can like use my voice to help. So yeah.
Thank you, Jessica. I see, Dr. Ayer, you have a question or something you wanted to say?
Yeah, I think what the last 2 points really resonate with me, and I'm a big believer. I think we need to what we call democratize research, and we're working on this initiative here at Sunnybrook to kind of try to do that, which is what we're trying to do is create a program where we collaborate with community pharmacies, and the pharmacist leverages their medication data for whatever 1,000 number of patients they have to see who would be eligible for research, and then give you the option to choose. But this way, it doesn't feel like it's sort of this ivory tower protected opportunity that it happens to, did you go to the clinic across the street or the other one? And that's what gives you the opportunity. Or did did your doctor have enough time to talk to you about it? So, these are things that we're thinking about this. We hear the message, and we talk about, opportunities for people to be involved in research. Once we finally slowly get this working, or as we slowly get the design part started, we'd love to hear from patient partners. If you are interested in sort of democratizing research and you're interested in trying to build that with us here at Sunnybrook, please feel free to get in touch with me offline. We'd love to have patient partners help us understand the best way to do this, because this is the first time we'll be doing this in Ontario. How do we appropriately engage people at the pharmacy level who don't know Sunnybrook, but we think they should have a fair chance to decide?
Great, thank you. So yeah, it's now 10:15, so we're coming to the end of the webinar. I just want to say thank you, everyone. Thank you to all our wonderful panelists for sharing your expertise, your lived experience, and just all the great discussions and questions that have come out of this. For all of you who've attended today, please keep a lookout for the email that we will send that will have the handout with resources, as well as, if you have any questions, you can email me. If you want to get in contact with any of the panelists, you can also email me and I can, forward that over. So thank you all for joining today. We hope that you enjoyed the webinar. And if there was any questions that wasn't answered, again, please feel free to email us and reach out. Thank you.